So you just found out you had a herniated disc. Your back hurts, doing everything hurts, and you're wondering, will I ever feel normal again? I've been there, and this is how I got out of pain. Hey, I'm Dr. Nick. I'm a doctor of physical therapy and functional movement therapist. And today I'm going to show you exactly how I got out of my disc herniation, how I started my healing journey, and what doctors won't tell you about spinal disc healing. And as we go through this journey, I want to point out the flaws in the healthcare system and how we are trading sick care for healthcare these days and what you can do to move yourself in the right direction. In our current healthcare system, over 15% of back pain sufferers get stuck in a chronic loop of pain. And that's because they never get to the true source of discomfort. We get stuck treating symptoms, chasing issues, and really treating them with passive treatments that don't solve the root cause of the movement dysfunction that caused the disc herniation in the first place. So today we're going to jump into the anatomy and physiology of the disc and the spine and the skeletal system that make up that spine of yours, how disc injured so we can understand how to best recover them, and why 15% of back pain sufferers get stuck in the chronic category, not resolving their issues. Then we're going to jump into how to fast track and support your disc healing, even if you've been stuck in that chronic category, and what disc healing looks like in real life from a client of mine who I greatly admire. So stay tuned for that because it may relate to you and give you a little light bulb moment on how to move forward from your back pain. Since suffering a disc herniation in my 20s, it really set me back a full year of movement and health and being able to do the things that I love because I was in the chronic loop of going to doctors, going to images, getting injections, taking the next medication, which never solved my root issue. So I want to help you to understand that right after we get into what the spine is and what the spinal disc is made of. And using these principles help me to move forward to be able to push, pull, climb, run, lift, and do all the things that I need to be able to do to live a full, happy, and pain-free life. And these days, it's my absolute pleasure to help people like you get out of pain naturally without shot surgery or medication. So if you're on board with that, go ahead and smash that subscribe button so we can move forward in this journey together and I can root you on all the way through the finish line. The spine isn't just strong. It is brilliantly engineered to give us the flexibility and stability to move, bend, twist, push, pull, and take on an enormous amount of compressive forces that we face each and every day. The disc is made up of two parts, the outer annulus fibrosus and the inner nucleus pulposus. The nucleus pulposus is the more gelatinous portion of the inside of the spinal disc. It is somewhere between 65 and 85% water, but also type 2 collagen fibers, which gives it some consistency and some ability to be more flexible and more shock absorbent. The nucleus actually rehydrates each and every evening while you sleep. We sleep in a horizontal position because that is a gravity eliminated position where gravity actually allows water to seep back into that spinal disc and we get a little taller each and every night. The annulus fibrosus is made up of cross-hatched fibers, so they are interwoven like this, and that gives us the stability we need to bend, twist, pull, and be compressed. However, with improper mechanical loading, improper movement patterns, or something just terribly negative like a car accident or a big fall, we can disrupt the outer annulus fibrosus fibers and that disc bulge can happen. And we can have a disc bulge, a disc herniation, or a sequestration where the entire annulus fibrosus fibers are broken through. And those symptoms typically correlate with leg symptoms. Down one leg, and the further we go down, the worse that herniation is, or the more severe and intense those symptoms can be, or down both legs. And then once we get into both legs, we can start talking about bowel and bladder dysfunction. And for any of you out there watching today, red flags would be bowel and bladder loss or loss of motor control of the toes or ankle. And if that is the case today, go and see your neurologist, get to the hospital, and make sure that you get care. However, if your symptoms are in one leg or in both legs but fluctuate with position, movement, and activity levels, even if it goes up or down, good or bad, and you still have good days, despite being in a chronic category, or if this is an acute injury for you, there is hope. And that's what the rest of this video is going to be all about. And when we talk about movement dysfunction, when we talk about poor motor control, those are the things that I see in my practice each and every day that hold people back from actually being able to heal because they're consistently irritating the injury. And with those type 2 collagen fibers, we want to give that tissue time to heal because it is avascular and does not get a direct blood supply. So let's stop picking that scab and make sure that we can move you forward here. But if you're still not sure which tissues are being irritated with your injury, then I've got a free guide to a better diagnosis that will help you go through those self-examination techniques and identify exactly which movements and which tissues are being irritated for free. Jump in that link below. Now that we understand the spinal disc and the anatomy of the disc, let's jump into step 2 and answer that question: can spinal discs heal? When I first herniated my disc, I felt broken. I felt like I would never be able to get back to my old self, and I was unable to do the things that I love, which just left me feeling depressed and alone. But what I didn't know then that I know now, and this changed everything for me, you guys: movement was the problem and movement was the solution. So moving better solved my pain, and solved it more than doctors could with advanced imaging, advanced medication, shots, and all kinds of money spent out the door, and time and pain spent waiting on these doctor's appointments when I had the tools right here in my own body. So as you all know, life is all about finding the gray zone. Too little stimulus, we don't get enough healing. So sitting down and laying down in bed and bed rest or sleeping on the floor is not the answer. On the other hand, moving too much, going for a marathon, constantly pushing and pushing through pain and pushing past pain triggers, also not the answer. We have to find in that bell curve the happy medium zone of just enough stress to start to stimulate those tissues to heal, but also allowing ourselves the rest and recovery in between those bouts of treatment and training, what we call your rehab program. So then the real question becomes, how do I get my discs to heal? And let's jump into that question. Now, the body has an amazing capacity to heal, and it works best when you give it the right environment and right stimulus to heal. So we talk in the FMT 360 program about nutrition, about mental health, about sleep, hydration, and yes, of course, movement. Research shows that up to 65% of discs will show significant reabsorption and healing within the first year. And I'm going to show you guys how to help yourself move forward and even better those results. But the 3 biggest mistakes are next, so hang on tight for that. And these 3 mistakes keep people in pain for way too long. For some reason, we don't talk about stopping the pain naturally and avoiding the triggers, avoiding the irritant. So step 1 is understanding your pain triggers. Are you triggered by sitting? Are you triggered by compression? Are you triggered by sleeping like a pretzel? What are your pain triggers? Think about that, and think about just after you do a movement, when is my pain the worst? If I wanted to have a really bad back day, what would I do? And then let's actively avoid that. Number 2 is overdoing it. Always pushing through, thinking I have to do this. I have to do this now, and I have to do this like this, the way that I've always done. That doesn't seem to serve my clients, and I wonder if it doesn't serve you. Is there a way to break up the task? Is there a way to ask for help? And is there a way to do it better? Can we do it with better spinal hygiene and better body mechanics so that you get it done without triggering your pain? And if you need help with that, I've got this great video I just shot about spinal hygiene and helping to keep your spine clean and safe so that it can heal well. And the number 3 biggest mistake that people get stuck in is the passive trap. There are good practitioners in every sense of the word: massage, acupuncture, chiropractic, physical therapy, doctors, you name it. There are good and there are not so good practitioners. We want to find good practitioners to work with us to help to move us forward in this. But those practitioners who only do passive treatments, maybe it's a manipulation and then you're out the door, maybe it's a massage and then you're out the door, without helping you to understand those pain triggers and pain alleviators, the rest of the system there is just as important as resolving some of that discomfort and allowing you to move a bit more freely. The idea of all passive treatment is to increase blood flow and decrease tissue tension. Basically it, right? We want to decrease some of those pain levels so I can move better, to improve my rehab process and doing the things that I love to do during the day or need to do during the day, even just washing, dressing, those kinds of things. But if you don't understand how to do life better, then that practitioner isn't serving you. And if you can agree with that, and if you understand that, go ahead and drop me a little love down in the comments, hit that fire button. Now, unfortunately, most cases of lower back pain get classified as non-specific lower back pain. And what that means, and it's really important for you to know your true diagnosis, but what non-specific means is that we haven't found the trigger. We haven't found the specific tissue. We don't know what's causing this pain. And then the rehab program is a dart. That's all we're doing there is throwing general back pain exercises at this. And is it going to work? Who knows? So by getting into the evaluation more succinctly, understanding those triggers, I can tell you guys that is such a key component. You've got to understand your current capacity for walking, standing, and sitting. Those three things will help you to move forward, and they should be improving week by week. But during the week, as you're going through your activities, stay under the threshold so that you can build up your capacity through your rehab program and without overexerting yourself. It's okay to say that I have limitations right now and I can only do so much. People will understand and they will respect you more for it. So set those boundaries and don't be shy about putting yourself first in this moment. A normal rate of healing is about 10 to 30% per month, depending on the severity of your back pain and disc herniation. So give yourself grace. Know that all the things you're doing are helping you to increase that amount of healing, and you'll be there sooner than later. When you're putting yourself first, doing all the right things for healing, and setting your environment up for success, great things are possible. So instead, let's take an active approach to healing. Let's learn how to move our body, regain confidence in our movement patterns, and we're going to do that today. And if we're able to consistently reduce our pain levels 2 to 4 points through movement and positioning and breath, how confident would that make you in being able to progress your healing and resolve this once and for all? Say you took your pain from an 8 out of 10 to a 4 out of 10 in just 20 to 30 minutes with some light activities that you do right from the comfort of your own home. Most passive treatments aren't going to be able to do that. You're going to end up sore and aching and bruised, thinking that this is a part of the process. It doesn't have to be. Gentle movement, gentle motor control, and gentle positioning and spinal hygiene can allow you to change those pain patterns because we're desensitizing your nervous system. Breath, movement, and positioning are absolutely key. They're fundamental to our ability to go through a successful rehab program. And when you're doing that successfully and know exactly what to do, your confidence will spike. And how would regaining confidence in your ability to move feel for you? We can't change the amount of time that type 2 collagen needs to start to reform and recreate that bond. It does take time and we need to be a patient, but we can start to optimize our movement patterns and desensitize our nervous system through that movement. Now, with most of my clients, I can help them to identify the essential program. And that is the 3 to 5 movements that will consistently drop their pain levels 2 to 4 points. And this is one of the reasons why I absolutely love mobility training, because we can gently start to move the spine. And by moving the spine, A, we're controlling those movement patterns and desensitizing the nervous system. But B, we're giving just enough movement, just enough stress to those spinal discs without threatening it, and most oftentimes in an unloaded position. And that's really important, because doing a hamstring stretch standing up or doing any mobility to the lower back standing up, you're being compressed by gravity. Many disc herniations, compression is a trigger, right? And one of the tests that we do is a heel drop test. We simply come back, we raise up on our heels, and we drop. Is that something that triggers you? If so, then let's manage that and let's move through in an unloaded position. And as we're talking about movement and retraining that movement patterns, we can be talking about the entire body here. If there's a lot of neural tension, well, the nerves start at the brain, which starts at the cervical spine. So we can even look all the way up top. Or if it's chronic low back pain, we start from the feet up and the floor up, and getting those feet to start to move and get some sensory input outside of heels, outside of super cushiony shoes, getting everything to move well together. And this goes hand in hand with a walking program. Walking upright is so fundamental to being a human. It is one of the basic movement patterns that all of us learn at some point. However, there's this one caveat. None of us were taught how to walk. We just end up doing it. And after a few injuries, a little bit of balance dysfunction, a little bit of compensation, our gait pattern can become very asymmetrical and very abnormal. You can use your phone's health app to look at your step symmetry and the amount of steps that you're getting throughout the day. So volume and symmetry. Very important to look at, two great factors to really make sure that we're walking well. We want a nice heel to toe pattern with opposite arm and leg swinging. And that's really important. A lot of people lose that and end up looking down at the ground the entire time that they are walking. So if you guys want me to dive into what a walking program is, what it should look like, or any other kind of questions that I might have stirred up, don't forget to hit those comments. Now, the second piece of the puzzle that is going to help disc healing is nutrition. And nutrition is not talked about enough in the disc healing space, especially by medical practitioners. Honestly, we were always told not to get outside of our lane. Personally, I believe that my lane is to help you to heal the best way possible. So the next piece of nutrition is managing inflammation. Now, we want to have an anti-inflammatory diet. And what does that mean? It means cutting out the excess sugar, especially processed sugar, processed foods. Such an important piece of the puzzle here. Let's cut out the sodas. Let's cut out the alcohol. I know that can be tough. And anything that doesn't have an expiration date. Try to eat your whole foods and get plenty of water. We need about an ounce of water per pound of body weight per day. It's a lot. You should be peeing clear and often. I know those of us who are trying to work and maintain a family, like, man, I have to go to the bathroom all the time. But it's huge. Your disc, we talked about, 65 to 85% water at that nucleus pulposus. Feed it, and then you will grow taller as you sleep, and that spine will rehydrate and you will feel better within just a few days, guaranteed. The other thing we want to do is we're trying to regain some mobility and strength. We're looking for protein. Protein is going to help us to maintain muscle mass, improve that muscle mass, and improve that muscle synthesis as we're rebuilding, reforming new fibers and creating those new neural connections. My recommendation is about 3/4 of a gram of protein per pound of body weight. So there can be a lot of variation on this and what people recommend. If you have any other outside medical issues, outside of just back pain or sciatica, do consult with your physician, your primary care physician, or your nutritionist to get some really dialed in information for you. We also want to make sure that we're getting in enough vitamins and nutrients and fiber as we're moving through those days to help us heal. My suggestion there is about 8 cups of fruits and vegetables per day. So the other reason that I'm recommending such a solid amount of protein is because of collagen. Collagen, as we said, type 2 collagen specifically, which formulates into type 1 collagen, actually comes from protein. And so into our bone broth, into our chicken skin, and really in through our protein synthesis, we will find collagen. Our bodies will absorb that, and that will help that spinal disc to heal. So go ahead and make that chicken nice and crispy, get that skin, and enjoy. And the other hidden secret here is vitamin C. Vitamin C helps with collagen absorption so that we can really take in those vitamins and minerals. So you'll see how the fruits and vegetables comes in with the protein, comes in with your water content to really give you all the nutrition you need to heal well. So I see a lot of challenging patients in my practice. Some of them have seen 8, 10, 15 practitioners before me and have been dealing with back pain for a significant amount of time. Katie is one of those patients who I just ended up latching onto. She and I jive so well because her mental focus and her determination to heal was unlike most. And if you want a great podcast to listen to, check out Healing with Katie Lane. I'm going to drop that link in the comments below. Love to give that a follow. This gal has been through it all. She was on a first name basis with the ER in her town. She knew exactly what the amount and dosage of pain medication that she needed when she had a flare up. She even knew the ambulance drivers. I mean, she had some really, really bad back pain and sciatica. But Katie didn't want surgery. She was told by multiple doctors that surgery was her only way out, and she had tried it all the conservative methods beforehand. So Katie and I worked for approximately 18 months together. Her disc herniation, as we've talked about, took time. And not only the disc herniation, but also correcting the movement impairments that were keeping her in pain and decreasing her fear of movement. After we've been in pain for quite some time, the fear of movement becomes very real. The fear of movement is called kinesiophobia. And this is something that happens to more people than is ever discussed. So as with the exact same approach we're taking with this video, we're looking at the entire person. We started looking at Katie from her feet all the way up through her knees, hips, mid-back, shoulders, neck, and then the way she thought about movement and the way she was thinking about her recovery program, as well as nutrition, sleep, mental health, all of it. And then sometimes it requires to go all in to heal. And that's exactly what Katie did. So these days, Katie is back to pain-free, thriving, and most importantly, if she does have a little bit of discomfort, she knows exactly what to do to get back out of pain through her essential program. So can spinal discs heal? Absolutely. But it takes more than jumping to passive treatments, advanced imaging, or surgery. It takes a comprehensive approach and an understanding of the tissue irritants and re-evaluating that so you can change your rehab program to match where you're at. So I hope this video has been helpful for you. If you're looking for more information on how to go about finding that essential program, how to go about diagnosing yourself, and how to move forward from back pain once and for all, comment below with Bye Bye Back Pain. I'll be happy to take you through a conversation and we can work through this together so you're never alone and you know exactly your next step on how to heal. And don't forget to smash that subscribe button, guys. I would love to stay connected with you, learn more about you, and cheer you on through the finish line. Until next time, happy healing.